Good day, everybody. I'm Joe Eisman, and I want to welcome you to LTADchat, which is a forum to share conversations about best practices in youth athletic development, youth sports, youth fitness, coaching, and physical literacy. Today, we are going to use our 1v1 or LTAD shorts format, where we have a scholar or practitioner share on a specific topic using a few visuals because a picture is worth 1,000 words. And as part of this format, we have been inviting individuals who have published research in this area, allowing them the stage to share and translate their research and their findings. And today, Lesley Sommerfield joins us. Lesley, welcome to LTADchat.
Thanks, Joe. A little bit about myself, I guess, before we get started. So I have been in the strength and conditioning field, I guess, around 7 years now, kind of in high school settings, working with youth all the way through collegiate athletes in private sectors, high schools, and colleges as well. Let's see, I have a bachelor's degree from Michigan State University. I'm actually representing this morning, so go green. Master's from Appalachian State. And then for this study, I went to New Zealand where I did my PhD at Auckland University of Technology.
Yeah, great. And you currently reside in Tyler, Texas, correct?
Yes, correct.
And today you're going to be sharing some of this work from your dissertation on adolescent female athletes. And I think part of the reason that you undertook that area of study is because there's really limited research in young female athletes. And I also want to pause at this point in time and note that this episode is part of a series specifically focusing on young female athletes. And we've done a few episodes already, one on coaching the female athlete, another on nutrition for female athletes. We're going to have this episode, which will be focusing on physical preparation, injury prevention. And then Lesley's going to join us again for a panel discussion where we talk about women coaches and youth athletic development. And for today, Lesley, I think what you're going to be doing is giving us a TED-like talk on both the injury audit from your dissertation, which you first undertook to kind of set the groundwork, so to speak, for this 23-week intervention. And before I turn the mic over to you, I just want to add that I was scrolling through your Twitter feed and I saw some great stuff like animal shape slider disc relays, crab walk basketball, physio ball relays. And on that tweet, you said, sound on for laughter, which was outstanding because sometimes we forget about the fun aspect of it, don't we? So I'm hoping you're going to discuss a little bit about some of those, fun yet challenging exercises that were included in the intervention as well. So I'm going to give the floor to you so you can share with us this research on injury prevention and physical preparation of the adolescent female athlete.
All right, thank you for that. So basically for my research, I wanted to try to implement an injury prevention program within the PE curriculum in youth female. So this was at an all-girls high school in New Zealand. And I wanted to do this because, like you mentioned already, there isn't a whole lot of research in females, particularly around like the high school age. So I wanted to kind of add to that research. So before I was able to do the program or even develop it, I wanted to figure out what kind of injuries were in my population. And the literature says that for females, the lower extremity is the most injured area. So I wanted to see, does my population have the same injured area? So I did a questionnaire for the girls. I did it actually the year before I did this intervention, and then also with the intervention. So they took a questionnaire for 30 weeks so I could track their injuries. And from that questionnaire, we see that basically, so acute injuries, those are injuries that are linked to a specific event. So we see the ankle, the knee, and the thigh are the top 3 injured areas. And then for overuse, those are the ones that cannot be linked to a specific event. You see the knee, which the knee, let's just highlight that, is over 50% of their injuries, the lumbar spine, and the lower leg. So this told me also, like, it went along with what the literature was saying, that the lower extremity is the most injured area. And as well as that, the lumbar spine, so that told me we probably need a little bit of core stability, little core work as well to work on that lumbar spine. So next thing I did was I went into the literature and I wanted to see, okay, what kind of injury prevention programs have already been done, and like what can I take from them? So what aspects worked, what aspects didn't, then I put it all together specifically for females. So the 5 kind of key areas that came up the most in programs that worked were plyometrics, agility, core stability, lower body strength, and balance. And those aspects kind of have to go along with where you see a lot of injuries happen. So when you're jumping, you're landing, when you're sprinting, decelerating, and you're changing direction. And also programs that were done 2 to 3 times a week for over 20 minutes had the most benefit. A few kind of takeaways from all those that kind of helped me develop my program and kind of practically speaking could help others. A big thing is, especially at this age, so I had 12 to 15-year-old girls, so they had no training age whatsoever. So really starting with basic movements, getting their bodies in the correct positions, landing from a jump, when you're changing direction, just when like kind of learning where your body needs to be in space was really, really important before we could move on to increasing their volume and intensity. And also individually progressing, because as we know in this age, they're all maturing differently. For me, the girls were pretty much all post PHV, so they had already matured, but still they're at different levels of training, or not at all. So some kids just move better, some don't, they need more work. So individually progressing this was a big part of it. And another really big thing was you can have the best program out there, but if there's no adherence to it, it's not going to work. So I was like, okay, how can I get this program to maximize the adherence? I was like, well, if we do it in the school day, I think that if the kid's already at the school, then they'll participate in this program. So that's kind of why I wanted to do it in the PE curriculum. And then sometimes you don't always have 20 minutes. So if you don't have 20 minutes, strength exercises kind of came up in all the programs that really worked. So that's what you should focus on if you don't have 20 minutes. So from there, I was developing my program. So New Zealand has a different kind of school system than the US. So they have 4 terms separated by 2 weeks holidays. So that's in the gray there. And those terms range from, they can be 8 weeks to 12 weeks. So I kind of wanted to sort out how to divide a program like that. So the first phase, the first block there, I kind of just focused on I wanted to get to know the girls who was going to be in my research. So I went to all their PE classes. I wanted them to be familiarized with me. So that way they would want to do the program. And then I kind of familiarized them with some of the exercises and some of the stuff we did for data collection before we got into the first phase. And since this was done in PE, I knew I couldn't take the entire time because the PE teachers still need to get through their curriculum. So the first 2 phases, I just did as like a warm up. So it was 10 minutes and then 20. And then the last term I was able to use their whole PE class, which was about 40 minutes. And the programs increased in the duration and time and also in their intensity and the resistance that we used. So it started with all basic body weight movements. Let's make sure we can, we know where we're supposed to be in these positions, how to land from a jump, how to do a squat, how do we stabilize our core, and then moving on where we added a little bit of resistance in some medicine balls, kettlebells, some slider discs, stuff like that. And then the last phase, we were actually in their like weight room setting where we could add a little bit more resistance. So here's my entire program. It focused on those 5 components that I found from that narrative review: plyometrics, agility, lower extremity strength, core stability, and balance. As far as some of those videos that you talked about on Twitter, I didn't incorporate a whole lot into my research, but the one thing that I did try to make fun for them was their balance. So especially like the last phase when we did balance, they had these benches that you could flip over and it was like a balance beam. So I had them going on that and then trying to touch different cones. So the cones were at different levels and different ways out. So we did those each direction, and that was more fun for the girls, at least, not just your typical like strength training session. So they end up really enjoying that. And also when we got into plyometric exercises and agility exercises where they're actually moving, so more of that second phase, they were competing versus each other. So I had them, race who can pause on this line fastest. Okay, you win. Who can get back to the line fastest? Okay, you win. And I added things in like we went and we ran, and then you grabbed a tennis ball, and then you came back, you paused, you gave it to your partner, kind of type things like that. So it would still be slightly more fun for them as well.
Yeah, Lesley, I want to interrupt real quick and ask a question, because I was on the last slide thinking about how you phased it in. And part of that was logistics, right? Like you integrated yourself into a physical education class. So you're going 10, 20, and then 40. But my question relates to, you know, something that comes up all the time, and that's how sometimes young females can be off-put by resistance training. Did you come across that? And if you did, was the way that you introduced it to them helpful?
Yeah, I would say I came across it a little bit, but I think it definitely helps that they see me like I'm a smaller female, because I think the biggest misconception is if I lift some weights, I'm going to get big. That's what they think. And that's not the case. So they can see me doing these exercises. They see where my office was kind of next to this like weight room setting. And so they could see me working out and doing things. And so they knew I was active. They saw me in the gym doing some stuff. So I think that was really the biggest thing, was like they saw me doing it. So they're like, oh, well, if she's doing it, I can do it too. So I really didn't have girls that were like, oh, I don't want to do this because of that. And I also think it helped that the whole first phase before I got into the program, I was participating in their PE lessons with them. We played games. We did different exercises. I was there with them. So they were like, oh, she cares about us. We're not just here for her research. We're here to kind of better ourselves as well. And I try to explain to them like why we were doing what we were doing at the beginning. And the majority of the girls in my intervention were athletes. So they really, really kind of were really into this. They wanted to get better. They wanted to improve. So they enjoyed what we were doing. And one other big thing, I found that when the PE teachers participated as well in the program, the girls also were like, oh yeah, because the PE teachers were all females as well. Well, when she's doing it, like she cares about this, she thinks it's important. I think it's important as well. So that also helped.
Yeah, so two things have caught my ears. Number one is role modeling, and number two is building trust and establishing relationships, which you did at the onset, regardless if this is research or your typical coaching, right? Like
Right.
you got in and you built that trust and established relationships with them, but the role modeling is exceptional as well.
So for the whole research, here's a few key findings. So first of all, I talked about initially with that figure with intervention programs that compliance is key. So just by administering this during the school day, I had an 82% adherence rate to the program, which is massive. And then also the questionnaire I had the girls do, they did that once per week for 30 weeks. And we did that at the start of their PE lesson. So they just took out their phone or laptop and took the questionnaire. It took about 5 minutes max. And that was, I had a 92% compliance rate on that. So that was also really good. The questionnaire, so it asked questions about their injured areas and then like where they were injured. But also our questionnaire was slightly different than a bunch of the literature, because the literature uses this definition of time loss. So the injury would only occur if you have to miss a training or a competition, which we wanted to capture the bigger picture. So we use an all physical problem definition. So practically speaking, if someone wanted to implement a questionnaire, it would be better to use an all physical problem definition, because a lot of athletes, especially, they don't want to say that they have an injury or something's hurting them because they don't want to have to miss training or competition. So this way, it gives them a way to actually tell you what's going on without them have to worry about missing something. For the program, so that whole program, I also looked at the injury rates between what was happening with the injuries throughout the whole term. So between the groups, the intervention and control, the rates were similar. And so the intervention group was competing significantly more and training significantly more than the control group. So the rates were similar to them. So which was really good. We thought that was kind of like a protective effect. And then looking at each kind of phase of the program, From phase 1 to phase 3 for the intervention group, the rates were significantly reduced. So I can say that this program reduced those rates for those girls who are competing.
Especially as you built up in the intensity and the volume as
Right.
well.
Yeah, I guess that's something to mention as well. So since we started really basic and we kind of only had the 3 terms, we really didn't get to some sport specific movements or speeds. So because we weren't really like jumping as fast as high as we could, or you changing direction like it's full speed. So I think a whole nother year of that would have really benefited us in terms of our performance measures. But the program, so I did look at performance measures of sprint and jump, counter movement jump. Those didn't significantly improve between groups. But then I also wanted to see their injury risk factors. So for this group, risk factors of balance is a big one. And then what's happening at the hip, knee, ankle, and trunk. So we did a back squat assessment and a drop vertical jump. Those were video rated, so then I could see what was happening at the trunk, hip, knee, ankle. And so those movements significantly improved as well as balance. So this program improved risk factors for injury. So it reduced those factors. And again, if you were going to implement this program, definitely start out with really basic kind of exercises, and it's important to individually progress them as well before moving on to increasing the volume and the intensity. But if you do want to, I mean, a goal usually of programs is to increase performance, so it would be important to try to get to more of the sport-specific speeds towards the end of your program. Another study that I haven't really touched on was, so we did an isometric mid-thigh pull to look at their strength values. And initially I divided the groups between a strong, average, and weak based on those scores, because I was interested to see what happens with stronger girls versus weak girls. And stronger girls had better movement ability, so they performed better in that back squat assessment and the drop vertical jump. They ran faster and they jumped higher. So they pretty much did everything better than the weaker girls. So it's really important to try to improve their relative strength. Kind of again, tying it back to that narrative review. If you have less than 20 minutes, or you like, what can I really just focus on? Strength is going to be really important, especially that lower extremity strength. And then kind of finally, as a key finding for the questionnaire that I gave, the final question asked them what day they were in their menstrual cycle. So I was interested to see if there was a certain phase of the menstrual cycle that more injuries occurred. So I followed up with each girl to see what phase they were on and get more information. And we did not find that there was a link between injury and phase of the menstrual cycle. Now these are girls who are 12 to 15. So not everyone has a regular cycle or even has a menstrual cycle at all. So kind of have to take that with a grain of salt a little bit, because this is specific kind of to this population of 12 to 15-year-olds.
So related to the adherence piece, so adherence is great, but part of the reason that they had good adherence is because it was, let's just call it a closed environment within a physical education class, and you were there. Mm-hmm. Now, besides adherence, like if you were to disseminate this, a coach, teacher sees your program, really likes it, starts to follow it, there's this part of fidelity as well, like how closely do they follow it? So what kind of advice do you have to people who may want to follow your program in terms of, you know, not just the adherence of doing it, but executing it correctly?
I think a big thing is you kind of do have to know your population. So if you have a population that's kind of already trained a little bit, you don't want to start really basic. You want to move on and try to make it a bit fun for them so that they do want to do the program. Like I said, I was having them compete and do different things, because it can get, if you're doing the same thing over and over, it can get a little bit boring for them, or they're like, oh, why do I have to do this? But try to make it challenging and make it a bit more fun. I would say though, always start really basic first and know your population. And then if they're proficient in their movement technique, then you can move on to more challenging things. Actually, the PE staff at the school where I was in New Zealand, they wanted to implement part of this. So I actually made part of it into a combined version for them that they could easily implement. Now it wasn't, they didn't do like agility exercises or anything, because they're not comfortable with those. but we focus on some strength exercises. I have some like crab walks, bear crawl stuff for them to do, to implement, to make things more fun. So I did come up with a little smaller program version of it for them that they can implement, and they don't have any sort of strength and conditioning background experience at all. But they are PE teachers, so they do know a bit about the body and how it works and stuff, and what to look for in a good movement.
Yeah. So how about those who may not have that background? Are there other resources available that you may be able to point them towards? Like if they look at that program and they may not be familiar with an exercise, any advice on where to look for, good resources related to this program? Or are you available to consult and do in-service workshops?
Yes, I could definitely do that for sure. I mean, I would really say like focus on the strength exercises for sure. And I mean, you can find out how to do those exercises online. Like there's so many, I'm sure that they, like, people that post these videos, at least like a respectable source can show you exactly how to do it. But definitely focus on like the squat pattern, focus on strengthening some glutes. So there's some just basic exercise you can do with that. And then really some like core stability. Like those would say I would really, really focus on. But yeah, also like, well, I guess learning to properly land as well, especially in this female population. Yeah, I mean, I'm definitely available if anyone wants to ask me any questions about this.
Yeah, and before we sign off, I'll allow some time for you to give some contact information as well. And I'm not sure if this is your final slide or if you have another slide to share.
Yeah, this is the final one. I don't know if you want me to go a little bit more in practically applications about anything, or
Yeah,
I try to kind of tie it in a bit, but
yeah, if you think there are other practical applications or maybe your top tips for training youth female athletes, that'd be great.
okay, a couple, tips I would say for this age group is especially try to really get buy-in with them in the beginning. So even before you start, get to know your population. All athletes, but especially these females, they want to know that you care about them. That you're not, like for me, because this was my research, that I didn't just care about my research. I did care about the girls. That way, especially with this questionnaire, sometimes it is, like, talking about menstruation is not the most comfortable thing, but everyone was so comfortable talking to me about it, and talking to me about any sort of injury they had, or even anything that was really happening in their life. So that was really awesome for me. And they had the trust in me that I had their best interest. So I really think before you even implement anything, it's important to, know your population, have them be able to trust you and talk to you about really anything. Something's happening in their life, they should be able to come to you because they feel comfortable. Not that they're scared to tell you anything. I think that, that's like the really, really big kind of takeaway from this, and just be that good role model for them. And as a role model, it's important for like me to stay fit and active, even doing anything. Like I picked up swimming when I was in New Zealand, and like we had conversations with girls. I had conversations with girls about that. So they thought that was really cool. I don't just lift weights all the time. So like, you can connect with them on different levels as well. They also loved asking me about things about the States. Is this aspect of a movie true? Things like that. So like just connecting on different levels, not where I was like, oh, we have to get through this. I want to be able to have a conversation with you. So I'll definitely answer your questions about this.
Yeah, super great. Lesley, thanks for walking us through your work and the key tenets of these papers from your dissertation. I know that you can follow Lesley on Twitter at LMSOMMERFEFIELD.
Yeah.
So Lesley M. Sommerfield. Or you can always find her work at ResearchGate or on Google Scholar. So you're always kind of a Google search away from some of her research on either of those two platforms, ResearchGate or Google Scholar. And Lesley, if there's other ways that people can get in contact with you, either email or other communication channels, if you want to share those right now, that'd be great as well.
Yeah, email, it's lsummerfield14@gmail.com. That'd probably be the best. or Twitter, either one of those.
Yeah, awesome. So thanks again for taking the time today and sharing this work with us. Thanks everybody for joining us for another session of LTAD Chat.
Thank you.